Many patients with Parkinson's have sleep problems. The common sleep problems in patients with Parkinson's could be of many different types. One of the main issue is multiple awakenings early in the morning, and then these patients have trouble falling asleep again. Sometimes this is referred as sleep fragmentation or terminal insomnia. Some patients have difficulty falling asleep at the night in the beginning of the night, and other patients have excessive daytime sleepiness. And some patients have what we call REM behavioral disorders. These problems may become more prominent as the disease progresses, and about 85% of the patients have sleep issues at some stage of Parkinson's disease. About 60% may have sleep fragmentation, some may have initial onset insomnia, and a small number of patients or a moderate number of patients may have excessive daytime sleepiness. There are many factors which cause these problems. For example, patients have a difficulty turning in bed. They may have motor restlessness. Some patients have nocturnal cramps. Others have restless legs syndrome. Sometimes they have frequent urination and they have to make many trips to washroom, visual hallucinations, confusion, anxiety, depression, pain, and early morning foot cramping make the sleep problem worse. Now, difficulty falling asleep in the beginning of sleep. So these patients may go to bed, but they are not able to fall asleep, and sometimes they may toss and turn, and they may, come out of the bed and walk around. Other patients may have vivid dreaming, nightmares, sleep talking, sleepwalking. This could interrupt their sleep. And causes such as depression and anxiety, they also cause trouble falling asleep. Some of the suggestions which can help to overcome sleep issues is that patients have to regulate their sleep-wake cycle. They should also regulate the amount of the sleep obtained each night. They should exercise daily, but not in the late evenings. If you do exercise in the late evening, you will have trouble falling asleep. Patients should do something relaxing before bedtime. They should have a fixed bedtime and wake-up time, even on the weekends. And they should also increase their physical activity during the daytime. And if they take a nap, the nap should be less than an hour during the daytime. They should also avoid caffeine as well as other caffeinated beverages and nicotine in the evenings. Patients should not sleep hungry or with a very full stomach. They could have a light snack. And these patients should avoid any fluids in the late evenings after 7 or 8 p.m. They should use a soft pillow and a firm mattress. They should also avoid hot shower in the evening. They could take a lukewarm bath. And the patients should make sure that their bedroom is quiet and comfortable temperature. There is a ventilation, and they should not watch TV in the bedroom. And if they can't fall asleep, they should get out of bed, read for 15-20 minutes, and then try to go back to sleep. Repeat this cycle until you fall asleep. And keeping the sleep area dark also is helpful. Having heavy curtains, closed windows, and some patients may need an eye mask. For excessive daytime sleepiness, which occurs in about maybe 30% of the patients or so, they may fall asleep during the course of watching TV or reading or doing some important activities. Sometimes if they take sleep medications at bedtime, they may still have sedating effect during the day, causing excessive daytime sleepiness. Restless leg syndrome may also prevent many patients from falling asleep until late at nighttime, and this interrupts their whole sleep-wake cycle. And as a result, these patients have excessive daytime sleepiness. Also, the patients who have sleep problems, they should be screened for depression and anxiety, because change in sleep pattern may be a symptom of depression, and if you treat their depression, this improves their sleep. The excessive daytime sleepiness can be helped by taking a short nap in the afternoon, improving your nighttime sleep, not staying awake until late at night, and addressing any of the problems which may interrupt the nighttime sleep, such as pain, difficulty turning in bed, frequent awakenings for urination. And engaging in more social activities and physical activities in the daytime is very helpful. Doing a volunteer work or any community service in the daytime. And sometimes drinking a hot cup of coffee in the mornings keeps you alert and awake. Going for a walk at a fixed time on a daily basis, this is also helpful. And following a routine of exercise is very helpful. The REM behavioral disorders, they are characterized by the patients yelling, shouting, they're moving their limbs involuntarily during sleep. Sometimes they may be punching their spouse or trying to choke them. So these patients are enacting on their dreams. And in the morning, they don't have any recall that what they were doing at nighttime. And this may start many years before the symptoms of Parkinson's disease. Patients with REM behavioral disorders usually are reported by their family members or their spouse, and the spouse may say that they were trying to choke them or punch them at nighttime, they were shouting, grunting, or they had a disrupted behavior during the sleep. Sometimes the overnight sleep study may be helpful to diagnose these problems. And to help this issue, the spouse should be asked the history of nighttime sleep of the patient. Sleeping on a separate bed, of course, could be helpful and safe for the sleep partner. And also, patients could have railing around the bed, which helps to avoid any falling, and moving any sharp objects or nightstands, lamps, or other things which can cause injury is also helpful. Moving the bed away from the window is important, and also sometimes placing a large object such a dresser or a cabinet in front of window is helpful. Of course, avoiding alcohol is very beneficial, and talking to the physician in case the medications are needed, they should be provided to them.